I think we're all in agreement here that home support is so important. It provides assistance with a wide range of activities, and it allows people to live at home as independently as possible, whether they're ill or frail or disabled. And it helps with washing and private personal care and so on. I just want to say, though, at the outset that while not all disabled people need or want home care support. Many do not require this service. In fact, they require a personal assistance service, which is something different, in order to enable them to live independently. But there has been a growing crisis in home care support over the last number of years. The demand for home care is growing considerably, and we can see an increase year on year in the number of people being approved for hours and being allocated home care. And the Disability Capacity Review shows that the growth and ageing of the disability population is likely to drive increased demand for home care services much further, as is, of course, people are living longer, so they're going to need more care in order to live at home. But the failure in home care provision is compounding further the pressure on our hospitals, because the lack of alternatives in community care has left thousands of people in hospital longer than they should be. And many disabled people are also left to languish for years in nursing homes for the same reason, and not somewhere they chose to be. It's just there was no alternative because the care wasn't there, in addition to the accessible housing. So many people cannot return home because there is not a carer in place to provide the care that they need once they return home. The programme for government seems to have thrown in the towel on the commitment it gave in its programme for government to implement a statutory home support scheme over its term in government, because it appears very unlikely at this stage. Instead, what they're talking about is introducing a bill which is entirely about licensing and regulation of a market of private home care providers. Now, at a recent Health Committee meeting on the 19th of June to commence the pre-legislative scrutiny of this bill, a principal officer from the Social Care Division in the Department of Health, when asked, does this bill deliver a statutory right to home care, answered it does not, and then went on to confirm that it is largely about licensing and regulations. It does not cover affordability, access or a statutory right or any of those issues. Now, when asked how advanced a bill to deliver statutory home care was, the principal officer replied that, to be clear, I did not say a bill is in development and did not mean to imply it is. There is preparatory work for a bill that will happen at some stage once it has been determined exactly what the content of it will be. So we are 4 years into a government term, a government that committed to deliver a statutory right to access to home care in its programme for government, and the government is not even at the stage of having a bill in development. So it's a safe bet at this point that before the end of the government's term, we will not have a statutory home care scheme in place as they had committed to implementing. It looks like the best the government will deliver is licensing and regulation of a market of private home care providers. So, like in 2017, the current Taoiseach, as he was Minister for Health at the time, committed to the introduction of a statutory right to home care. In 2020, when questioned about it, he said the scheme was almost ready. But we're now 4 years on, and almost ready, it seems the government are nowhere near ready. So the failure to deliver on its programme for government commitment to a statutory home care scheme is pushing older and disabled people into hospitals and nursing homes, or into early admission to long-term residential care when they could be cared for in their own homes if that is their wish. And it was highlighted by the Ombudsman in the report Wasted Lives, which stated that the implementation of this scheme is necessary to address the current bias in favour of placing people in institutional settings. Now, a large number of people have been assessed as needing home support and are waiting very lengthy periods on this due to carer availability. I mean, hundreds of these people are experiencing delayed transfer from acute settings. There are no carers available to them because, the government has failed to plan for a sufficient workforce. So when changes to the pay and conditions were introduced, no additional money was provided for that. What then happened is that, in a sleight of hand by the government, the number of home care hours provided were reduced to pay improved rates and conditions to staff. Now, I absolutely agree with improved conditions and rate of pay to staff, but unfortunately it's the older people and disabled people who paid the price for that, having their hours of care reduced. And it's left many family carers to carry the burden on their own. I'm constantly contacted by families, as I'm sure we all are, who do not have sufficient carers. And I've had an instance where an elderly woman who was confined to bed, who required 2 carers at a time to lift the hoist to change her. Sometimes only one turned up, sometimes none turned up. She actually spent a whole weekend where she had no carers at all. And she ended up then in a situation where she didn't eat or drink so that she wouldn't soil herself, because otherwise she was going to be left just lying in this for the time. I have another lady at the moment, a young woman. She has locked-in syndrome, so she cannot move anything other than her eyes. She has home care, a package in place. It has never been realised, her mother told me. So there are 3 visits in the day. It requires 3 carers at a time because it requires the use of a hoist. They never know when 1 carer or 2 carers will turn up. They never know when none might turn up. They don't know from moment to moment how many carers will be there, if there will be sufficient. And that's not fair. That's not fair on that family. And I mean, it was inevitable this crisis won't get worse because home care staff were included in the recruitment freeze. So the authorisation scheme introduced last summer is a step in the right direction as it has moved away from the lowest cost tender model. However, the pricing set by the HSE under the new system is not sufficient to cover the new costs of travel time and hurts the ability of the sector to continue paying above average rates of pay. And it's further damaged by the continued pay gap between Section 39 and the HSE service providers. And importantly, it only deals with older person services. It does not apply to disability services, which means that more complex care is less attractive for providers. Now, in November last year, it was during a motion on home care workers and home support, the Minister for State with Responsibility for Disability, Minister Anne Rabbitte, said the HSE is currently progressing the development of a new disability service procurement framework with the expectation of finalising the framework in Q1 of 2024. And that any amendment to the disability service home support rates will be considered in the context of the procurement exercise. So I'm just wondering, like we're at the end of Q2 of 2024 now, can you update us on where that is at and is that almost been completed? So I suppose the reality is that the government promised a statutory home care scheme. It's failed to deliver it. At best, what they will deliver, if they get the health amendment licensing a professional home care supporters bill passed, is a scheme to licence and regulate private home care providers. The scheme does not provide or chart a path to universal access. It does not meet the expectations set under Care or in the programme for government. Home care is essential to reducing pressures on hospitals, discharging patients on time, maintaining independence for people who do not need nursing home care. So Sinn Féin would deliver a statutory home care scheme centred on access to give people the choice to remain at home instead of moving to a nursing home.